Hey everyone, I'm Lincoln Parks. Welcome to the I'm Local podcast. In a world where big corporations dominate the market, it's easy to forget about the unique and vibrant businesses that make our communities thrive. That's why I created the I'm Local podcast, a podcast dedicated to showcasing the incredible stories and contributions of local businesses just like yours. Each episode, I'll be diving into the heart and soul of a different local business. We'll hear from the passionate entrepreneurs behind the scenes as they share their personal journeys, their business philosophies, and the challenges and triumphs that make ownership so rewarding. Whether you're a longtime resident looking to rediscover the hidden gems in our own backyard, or an aspiring entrepreneur seeking inspiration and guidance, I'm Local is here to connect you with the stories that matter most. So buckle up, get ready to be inspired, and join me as we explore the fascinating world of local businesses on I'm Local. Well, hello, my name is Lincoln Parks, and this is the I'm Local podcast. Today, I'm excited to have our guest on, Dr. Gabrielle Williams from Gateway Directed Health. Dr. Williams, welcome to the podcast.
Thank you. So nice to be here. Thank you, Mr. Parks.
Absolutely, absolutely. Okay, and we'll get started right here. So, tell people a little bit about yourself and your background, and how you got started in business.
Sure. So I am from Miami, Florida. Originally, I'm of Haitian descent, and we moved to
Okay.
Atlanta in early 2000s. So I've done elementary, middle school, and high school here. I went to the University of Georgia for undergrad and then Medical College of Georgia, Athens campus for medical school, and decided to do a family medicine residency. Wanted to be able to help people with a lot of issues, be able to take care of a lot of issues and not be too specialized. And so I chose Emory Family Medicine Residency for 3 years for training, where I trained at Emory, Grady, the Children's Hospital of Atlanta. And then I worked outpatient, meaning in the clinic, for a few years and realized that a lot of people are dissatisfied with that model where the doctors are seeing 20, 25 patients a day, and the patients are
Yes.
limited to 5 to 10 minutes with the doctor, can only address one or two issues, and feel like the
Yes.
doctor doesn't know them, the doctor didn't spend adequate time with them, did not address their concerns. And so I was like, well, tired of that model and wanted to provide
Yes. Yes.
patients what they're looking for, which is great care. And that great care includes education, right? Shared decision making. It's not a
Right.
medical decision just based on what the doctor says, but making sure to educate patients on the many options they have. And then we come up with a plan together. But that takes time. And so with my practice, Gateway Direct Health, it's a concierge practice where patients have a personal doctor, a doctor who knows them, a doctor they can
Mm,
trust, a doctor who is going to make sure that they feel seen, heard, and understood, a doctor who is going to
yes.
explain and we're very big on advocacy, who's going to help you navigate the healthcare system. And we spend
Mm,
long, unrushed visits with patients, 30, 45 minutes, and addressing their concerns so that they leave feeling heard and feeling valued and feeling like they do have someone, a trusted partner in their healthcare journey.
wow. That is phenomenal. You said a mouthful, because what I'm really excited about. I always knew about concierge healthcare, um, but I did not know that we had one in Henry County, which is phenomenal because that's what, like you said, that's what a lot of people are looking for, and I'm excited to hear this. So I really we're gonna dive in a little bit deeper into that because there's something I want to hear. But something you said earlier from your background that you are of Haitian descent, which is awesome. I was born and raised in the Bahamas, so we have the
Oh,
island connection going there.
yes.
Yes, yes. But so
I
getting
figured
back
you
to
were Caribbean
your
descent.
professional, you did.
Yes, your accent.
Okay, so it comes out now. People from the Caribbean, they can hear it, but then other people are like, "You don't sound like you're from the Caribbean," but
Right.
people from the Caribbean can hear. Yeah.
Yeah.
So I I wanted to ask you about, okay, this concierge service. I want to dive a little bit deeper into this. So, do you see male, female? Is it just female? Do you, what's like the main focus of your practice, and what are some of the common things that you're seeing right now that people are coming to you about?
Great question. Like I said, I'm family practice trained. And so in my practice, I see all adults, so men, women, geriatric patients, older patients. And my
Okay.
focus is on lifestyle medicine. And so people are like, well, what is that? So that is a focus on
Yeah.
changing our lifestyle habits because I've been telling patients, unfortunately, the American culture is killing us, right? Where we have to work really hard, one, two jobs, take away most of our time away from our family, um, and
Right.
be at stressful jobs and don't feel supported, and then um, excuse me, and that's raising our blood pressure, that is decreasing our quality of sleep, that can definitely mess with our social connections and emotional connections and mental health, of course. Not just the workforce, but just American culture in general, where there's fast food in every corner, right before there is good
That's
healthy
right.
food available. And so I focus on lifestyle changes on the holistic person, so we are not just focusing on your physical health or
Right.
saying, oh, what's your blood pressure? What's your sugars? My patients are not numbers to me. I ask about their whole health. So their
Right.
spiritual, emotional, mental, stress levels, sleep, romantic relationships, making sure they are in safe relationships, or assessing if they are. And so we are focusing on the whole person. So as a family practice provider, I can handle lots of things: high blood pressure, diabetes, sleep issues. We definitely do women's health and men's health because they're all important.
Okay.
Though, like I said, from a perspective of lifestyle medicine to see what things that we can change, because there's a lot of conditions where we don't need medications for. You can if it's really
That's
severe,
right.
but there are a lot of things that we can do or the patient can do themselves to help decrease the plight of the disease, like gout. A lot of people don't know that gout is
Yes.
influenced by what you eat and drink, including alcohol, seafood, red
Mhm.
meats. So if we cut those things out, or even if we pay attention to what we're eating and see if there's a correlation with the symptoms, we'll definitely be able to point out, oh, this when I take this medication, excuse me, when I take this food or drink this drink, that's when my gout starts to flare up. So now let's make lifestyle changes. Let's cut
Right.
those things out so that you can enjoy your life, right?
Yeah.
Be functional and not have to be in pain.
Absolutely. Absolutely. You brought up so many great points. So this is something that, my wife and I have been embarking on, just actually started, because we've been doing a lot of research ourselves, personal research, and we've been seeing, with all of the health problems in America right now, like you mentioned, it is because of the foods that we eat. So we were looking at, okay, the meats. Where are these meats coming from? They're coming from these farms, and the farms are unhealthy. The animals are eating unhealthy. They're trying to grow them. They're
Mhm.
injecting them. You go from the red meats to the chicken to the fish farms and all of this. So in your recommendation, or what I want to ask you is, how do you feel about, and the foods that we're eating right now is affecting us? So do you recommend people go vegetarian or vegan, or what's your recommendation there?
Great question. Thank you. So, my recommendation is to find a diet that is sustainable. Now, for some people, that's intermittent fasting. They can do it. Some people can't. And so they'll
Okay.
do it for a little while,
Right.
right? We go on these special diets for a little while, but it's not sustainable.
Yes.
It's not enjoyable. And so then we go back to the old habits that we had. So, my answer
Right.
is always find a diet that is sustainable, that you something that you
That.
enjoy. Yes, the things
Yeah.
that we like are healthy, like the sweets, so we do have to modify. But for
Right.
some people, veganism is perfect for them. So for some people,
Mm.
it's
Yeah.
vegetarian, pescatarian, right? Omnivores, great for them. But finding a diet
Right.
that's sustainable that includes plant-based foods, right? All diets, right, should
Absolutely.
include a lot of plant-based, because we know that food is medicine, right? Those plants include
Right.
a large number of fiber, of essential minerals and vitamins that we need, and help with
Mm.
our gut health, right? Because we know that
Right.
when we get stopped up, we got a problem, or if we're not
That's right.
digesting
That's right.
correctly, right? So yeah, so some people they love chicken and they're like, I'm not becoming vegetarian. Okay, that's fine. But let's make sure that it's
Right.
healthy chicken. Let's make sure that it's not fried all the time. Let's get some baked chicken. Let's get
Right.
some good seasoning, right? Some good Caribbean seasoning so that you can enjoy that food.
Absolutely.
Because
Yes.
if I gave you a breast with no seasoning, you're not going to eat it. And so then you'll go back to fried foods, right? So again, finding
That's
something
right. That's
enjoyable
right.
and
That's right.
sustainable. It does take creativity.
Yes.
So I tell the story of how we
Right.
make spaghetti, but we puree carrots and put it in the spaghetti sauce. So the kids, can't really tell
Mm.
that it's there, but they're getting their vitamins, minerals. So
Right.
that's something creative where it is spaghetti, but they are getting essential minerals and vitamins. And um, you got to be creative with your smoothies, right? So there's ways to
That's
get
right.
the recommended amount of nutrition, excuse me, but it does take creativity and it does take finding something sustainable.
Oh man, I'm really loving this conversation and really want to keep this going. I want to ask you, like, what from your practice standpoint, what has been one thing that maybe have been a highlight in your business, that you would want to share with others.
Oh, yes. So I love this story because it tells how important it is to have a healthcare advocate. So I had a patient who fell and hurt her wrist, swollen, could barely move it. So my first thought is that it's fractured. And the
Mm.
same day we were able to get an x-ray to confirm that she had a fracture. The same day I was able to get her scheduled with the orthopedic specialist around the area. And then in 2 days, she had surgery. So that's the level of advocacy that we are doing at Gateway Direct Health. We know that there's a hassle with
Yes,
trying to schedule appointments. You're on hold for 30 minutes. Then, for some reason, the phone
absolutely.
mysteriously hangs up. Then you have to call back and wait another hour. But we're using our power and influence as medical providers to talk with different specialists to schedule appointments for our patients to make sure that they understand, if something is urgent, how urgent it is, so that we're all on the same page to make sure that that patient gets the healthcare that they need in the time that they need it. So that's a great
Mm.
true story of a patient who broke her wrist.
Yeah.
We were able to confirm by x-ray same day. She saw the orthopedic specialist the same day and got surgery a
Same
couple
day.
days
Yes.
later. Hmm.
Wow, that's phenomenal. I love to hear that, and I love the work that you're doing because it's so important, and it's just different, and more people need to hear this and learn about your practice. So, I want to ask you this. And we're wrapping up right now. So I want to ask you something other than your business. You live and you have your business in Henry County. Um, I want to find out what local businesses. It could be a restaurant, it could be whatever that you in this community that you love to frequent or you love to go to. Do you have any of those?
Ooh, yes. I have the McDonough Moms Group. I mean, that is a
Okay.
phenomenal Facebook group for moms in the McDonough area. They provide lots of great events. We did a vision board party a couple weeks ago, and we're really clear, trying to get clarity on what we want for 2024. They're having a
Yes.
Galentine's in February. McDonough Moms Group is absolutely excellent. Um, and then
Okay.
we
Awesome.
have, yes, yeah, that's a business that I want to shout out.
That's great. That's great. So now I'm going to ask you this: do you have any hidden talents that nobody knows about?
That no one knows about?
Yes.
That's a great one. Um, I don't know if it's talent, but I love to dance.
Okay.
I'm
Okay.
Caribbean.
All right. Absolutely. That Caribbean and dancing just goes together.
Correct.
Yes, yes, yes. So, Dr. Williams, I am so excited that you were able to share, a lot about your practice and what you do and how you're helping out um, uh, individuals their whole body, holistically, everything, spiritually. I mean, it is phenomenal. And if people want to get in contact with you, they want to learn more about what you do, they want to come to the practice and really speak with you and really get themselves, how can they get in contact with you?
Sure. So, gatewaydirecthealth.com. And I know how scary it is to try to find a new primary care doctor or a doctor in general. And so I do free consultations so you can get to know me and ask questions about the practice and see if it's a great fit for you. So, why buy before you try, right? So if you go to
Absolutely.
gatewaydirecthealth.com/join-gateway, you can schedule a free meet and greet with me and we can discuss how we can best serve you based on your health goals.
Love it, love it. Now, do you have a physical location that people can come to?
Yes, we are located off of Rock Quarry Road and Eagles Landing Parkway at 1106 Hospital Drive. We're on the third floor. And we're also on social media on Facebook, TikTok, Instagram at dr.notms or at Gateway Direct Health.
Awesome. Dr. Williams, thank you so much. I really, I'm going to send my wife to you. She needs to talk to you. And she's going to schedule one of those consultations. I love, that's why I love doing this, because I meet people that I've never met before that are in this community that are doing great things, and we need to get the word out. And so,
Yes.
I appreciate you coming on and just sharing about your practice and what you do. I'm totally excited, and I'm sure people that are going to hear this are going to want to schedule some appointments with you. So thank you so much for coming on and sharing your story.
And thank you for creating this platform so that people know what's local.
Absolutely. Well, I appreciate it, and hope you have a great day. Thanks.
Thank you. Bye.